Sometimes in your life, you are referred to a rheumatologist, or you need to change your current physician. You either move to another city, or your rheumatologist leaves the town. Your rheumatologist doesn't take your insurance anymore, or you need a second opinion. It is a big challenge to find a doctor with the expertise, the time, the bedside manners, who will be accessible to you when you need him. How should you find the rheumatologist that will treat you and not only your disease?
rheumatologist OnCall.com.
Here are the 7 red flags that you should be aware when choosing your next rheumatologist. The doctor has no reviews online. When patients receive a referral to a specialist, most patients have the diligence to research the doctor on Google. So far, Google has proven to be an excellent resource to find information about a doctor's expertise and the work history. In just a few minutes, you can see where the doctor was trained, how many publications in his field of expertise, if he or she was awarded for their work, and what previous patients say about their experience with that doctor. If you cannot find much about that physician, you should wonder, how is this possible in this era? Many hospitals and clinics are encouraging patients to share their personal experience. Many patients will leave a review to help other patients have a great experience or advise others to avoid that office. If you find a few reviews from patients, this is definitely a red flag. The doctor rushed me off the door. If you arrive in an office that is flooded by patients, you should expect a short time with that specialist. Unfortunately, there are not enough rheumatologists in the United States. In the traditional medical system, physicians have many limitations in seeing patients. Some of them will see you only if you are part of the hospital system or if they are contracted with your insurance. Many hospitals will push physicians to see up to 30 patients a day. In that case, of course, the time is limited. However, you should experience something else when you see a specialist. Your doctor should never rush you off the door. Your concerns should be heard and your questions should be answered in full. In our practice, we spend extensive time with patients and never rush them out of the door. The doctor looks mostly at the computer and not at me. In the traditional system, a physician is incentivized to see more patients, document extensively, and place proper coding to receive payment from an insurance company. Today, the time spent on documentation is 3 times more than the time spent with the patient. That is why in the traditional system, the physicians will focus more on documentation and spend less time paying attention to the patient. But there is another way of practicing medicine called direct care rheumatology. This is a way for the patients and the physicians to rebuild trust and reconnect. The physician is not a slave of the insurance company and is working for you. It develops a plan and spends time with you and gives you his best medical opinion. The doctor did not return my calls. If you scan through reviews of many patients, you will notice a common reason of dissatisfaction. And that is because patients do not have their questions answered. In the traditional practice, the time that you spend with a physician is between 7 and 15 minutes. Many of your questions will remain unanswered. When you have questions and make a phone call to your physician's office, you will not only wait on the phone for hours, but even if you leave a question to the front office, it may take a few days to get an answer. Why? Because your message might never reach the physician in time, or the physician is too busy, has too many tasks and patients to see, and they might forget. and there is not enough staff to follow up on the patient's phone calls or messages. The cost of the test, imaging, and treatments is hidden. When you go to an office, many patients have absolutely no idea about the cost of their medical care. Let me ask you something. Will you ever go to the best steakhouse in town, order the best bottle of wine, and then the most expensive steak if you know that you cannot afford it? When you enter a medical office without an emergency, you are most of the time asked to provide your insurance card before even they ask for your name. A stack of papers is pushed under your nose. A pen is handed to sign that you will be responsible for paying if your insurance decides they do not consider that you need the visit, the test, or the treatment. And of course you will sign. Your focus is on your health, not on the papers that you will sign. Then, in a few months, you will start getting surprise bills. The financial burden could be massive. That is why I encourage you to ask for the cash price for your consultation, for the test, and for the treatment. In our practice, Rheumatologist OnCall, we offer affordable and transparent pricing for all our services, from consultations to the laboratory, imaging tests, and treatments. The cost of your laboratory and imaging services can be even 10 times less discounted compared to traditional medical services. We never send you a surprise bill and will work with patients to customize their medical plan to their needs and within their budget. We work to serve you and not your insurance. The doctor only offers me office treatments. 20 or 30 years ago, when the first biologic treatments appeared, they were mostly given to patients via infusions, which is a medication given to patients through an IV line. You would have to be in a physician's office under strict medical supervision during this treatment to receive an infusion. That means you will have to get a lot of time from work, at least once a month, to receive that treatment. On the other hand, the physician's office can bill more from your insurance for this procedure. But these days, besides medications that are given through an infusion, there are many other options, like subcutaneous injections that you can give to yourself in the comfort of your home, or even pills that you can take daily. You do not have to get time from work, travel to an office, and spend half of your day receiving treatment. Your physician should discuss all your options, and their incentive should be your well-being and your comfort. Of course, some patients might benefit from infusions, but your physician should always offer multiple treatment options. They should be your coach, not to dictate your choice. In our practice, Rheumatologist OnCall, we educate patients about their medical options. Together, we make the final decision about the need to treat. It is always a personalized approach that meets the patient needs. We treat people, not diseases. The doctor does not listen to my concerns. When you get diagnosed with an autoimmune disease like lupus or rheumatoid arthritis, you need time to process this new information. You may not be ready to jump on treatment in the first visit with your physician, and you may need more time to understand the risks and benefits of a certain treatments. Education and time with patients are essential. However, most physicians focus on the traditional therapies they are comfortable prescribing. But patients are unique and their expectations are different. Some patients are looking for more than just a pill. They might be interested in addressing the root of their medical problem rather than treating the symptoms. Most patients seek a personalized approach that suits their needs and their comfort level. Rheumatologist OnCall partnered with a specialized physical therapist to develop a complete exercise plan tailored to arthritis patient needs. I have additional training in nutrition from Stanford University and mindfulness from the University of Massachusetts. I even designed a food and lifestyle pyramid to help my patients with inflammatory diseases like rheumatoid arthritis. If you like the educational content of these videos, please don't forget to subscribe and share them with people that might need these advices. Finding the best rheumatologist near you might be sometimes very challenging. Knowing these red flags will allow you to choose your next physician wisely. Dealing with an autoimmune disease is enough for many patients. Navigating the traditional healthcare system can create trauma for many patients. If you need quick access to a top expert rheumatologist, an integrative and personalized approach that will fit your needs, time, and if you want direct communication with a physician, as well as affordable and transparent pricing, Rheumatologist OnCall is the practice that you are looking for. If you want to learn more about autoimmune diseases, arthritis, lifestyle interventions, please don't forget to like, share, subscribe the channel, and you can share it with people that are in need. Don't forget to leave your comments down below, as I'm happy to look at them and address your questions and your concerns. Have a wonderful day, and thank you for watching my channel.
rheumatologistoncall.com